and instead of using a drug to treat a symptom, I look for the root cause of why things happen. So, I had a guy with Alzheimer's disease. He's years he's had Alzheimer's. His wife is leading him around, and he's like shuffling around, and then he got arthritis, and his wife was told he had gout. He went to another doctor. The doctor said, I don't think he has gout. You should go see Dr. Saunders. And so he came in to see me to see if he had gout or not. And so it turns out he was a welder and had lead toxicity and was. You probably heard this story before. I talked about it, right?
It's been a long time though.
Yeah, but it's so dramatic that in 30 treatments of EDTA chelation, he no longer had Alzheimer's and no longer had arthritis. So his arthritis went away, but so did his Alzheimer's completely. Even today, 7 years later, he's a perfectly normal, healthy guy. So if you find the cause of something, it's so gratifying to me. And so I do a lot of work. I'll spend hours researching somebody's illness and going, what is causing this? And I've found some really interesting things.
Yes, we're on. Hi, guys. It is Thanksgiving week, so we are excited that you guys are here. My kids are home today, no school. So you may hear some extra noises. You never know. My daughter did just come in here just a little bit ago, but it's fun. I always like it when they come home, and I like Thanksgiving morning. I always want to watch the Macy's parade every Thanksgiving morning. It's just a tradition that I do. It must have been started when I was young. I don't even remember. But they usually watch it for a solid 10 minutes before they're bored of it.
Solid 10 minutes. That's not attention deficit disorder.
No. It's just, if the parade isn't giving them candy, if they're not getting candy at the parade, then they don't care about it. So unfortunately, maybe they will this year. We'll keep trying. So let us know. Do you guys have Thanksgiving traditions that you guys celebrate? We will then go and spend some time with family, which will be fun. I'm actually making I'm trying to incorporate a little bit more of the Mediterranean diet into my diet. So I'm making, I've heard it pronounced so many different ways, tabbouleh or tabbouleh or whatever. I'm making that with quinoa. And then I'm making what else am I making? Well, actually I have a bunch of different events going on this weekend. So we're making a lot of food for some different things, but we'll have the traditional turkey, mashed potatoes, all of that kind of stuff at the Thanksgiving that I'm going to go to. So it'll be hard to not overindulge on some of those things, but it'll be fun to be with family. How about you, Dr. Saunders? What do you guys do for Thanksgiving?
We do traditional turkey, same stuff. And I usually make some kind of food. I often will cook the turkey, and then I'll make the green beans with some bacon in it. And
oh, yes.
I make mashed potatoes and all that stuff too.
Yum. Yes, that's good. There's always good food on Thanksgiving. That's fun.
We used to love the stuffing, but now we have two members of the family, now 3 that are gluten-free. We don't do the stuffing anymore.
Yes, that's the dishes that I'm bringing are gluten-free as well. We actually have a few people in our family who, not celiac, but try to avoid gluten as much as possible. So we're going to do that too. Okay, maybe I didn't. I just adjusted the chat so you guys can chat again. I have yet to figure out why it doesn't just automatically do that, but there you go. Okay, so today, type 2. If you're new here, this is what we do each week. We come together. Usually Dr. Saunders and I are here. Sometimes we bring in somebody else from the team. Joe's here often, the founder and CEO of our company. And we talk about type 2. Every other week, we really focus on one topic that's usually pretty specific to type 2, or maybe one that we're getting a lot of questions about on our webinar. So the beauty of these webinars is that you guys hop on, Dr. Saunders teaches, and then we can ask questions. And so feel free to do that in the Q&A. If you're on Facebook, go ahead and post those in the comments. We'd love to hear from you. But yeah, I think that's it for the background stuff. If you have a friend who might be interested in this webinar, send them to bartonwebinar.com, because there they can find more information. They can register for the free webinar while it's free. It could cost someday. There are people on our team that want to charge for it. So just saying. We love doing this though. We have met so many of you. I've gotten to chat with a lot of you about your journeys using mostly, I'll just show you here, the diabetes solution kit. So if you're not, I have my blur on. Oh boy, I'll have to take that off. The diabetes solution kit. Oh, look what it's doing to everybody. Oh, that's funny.
It picks out faces.
That is so cool. All right, I'll take the blur off. There you go.
There.
So mostly everyone not everyone, but 75% of the people on the webinar are using the diabetes solution kit. And so if you're not familiar with this, you can find this at bartonwebinar.com. This is what Dr. Saunders uses for his patients in his office. What he would recommend for somebody who is just diagnosed with type 2, or maybe they've struggled with it for a while and they're looking to try something different. It is mostly food-based. I will tell you, he likes to get to the core of the issue and use food. And we do talk about supplements on this webinar, but he still prefers food because supplements help, right? Isn't that what we say, Dr. Saunders?
Well, that supplements are needed sometimes if you have a deficiency or something. And this goes back thousands of years. If you look at, 3,000 years ago, Hippocrates is saying, let food be your medicine. And rather than, they had medicines too, but they were using things that calomel, which is a mercury, they were using things that were, toxic, like our medicines today are all toxins. That's what they do. And so food is still a better way to do it because it's more of a long-term solution.
I know. I remember a doctor told me that it wasn't you. That food wouldn't make a difference in some of the digestive issues that I was having years back. And I thought, so I could eat Snickers all day and you would tell me that still isn't impacting my gut health? That's just crazy to me. So he's no longer my doctor, but then I met Dr. Saunders and my eyes were open to other things. So anyway, I'm kind of rambling, but let's go ahead and get started. Dr. Saunders, would you mind sharing a disclaimer with us before we begin?
Okay. We disclaim all responsibility. It's all on you because it's important that you understand the information that we're using here today is for general use and may not apply to you specifically. So, if you need help, then your doctor, practitioner, whoever expert should be able to help you with is this right for me kind of thing. So I heard this on the internet. You go to that's the best thing. Go to your doctor every time to say, I heard this on the internet. Is that right for me? And your doctor will roll his eyes or her eyes. Really, Bruce? And then go on and, like you said, nothing at all.
I did just read, someone had shared some information about the things that you should say if you go to the doctor. So if you feel like you want to try to do something different than what traditional medical doctors would say, that you should show up to your appointment with your medical doctor and say, my sister really thinks that I might benefit from this. What do you think? So it takes the pressure off of them a little bit to feel like they have to argue with you.
Diagnosis, or right?
Yeah.
Or argue with another doctor or something.
Yes. So
right.
Kind of interesting.
Yeah.
Okay. Our friend Eric is on, and he just asked. He wondered what the name of your integrated medical center is. And while we're discussing that, maybe you can just share a little bit of information again about who is Dr. Saunders and how did you end up on this webinar today?
Okay. Well, I met Joe a long time ago, and he said we were sitting next to each other. It was the weirdest thing because we were at a conference in Los Angeles. We were both away from home, and we were discussing what we do. I said, so what do you do? He says, oh, I publish health reports, and I say, oh, that's interesting because I do a lot of integrative and alternative kind of health kinds of things. He goes, oh, really? I'm actually looking for a doctor to help me out with these reports, edit them and talk about them and explain them to people because I'm not a doctor and I don't know how to explain them. And I go, well, that's right up my alley. He goes, okay, well, let's talk. And so we ended up talking, and gosh, what was that, 15 years ago? And now we've gone through a lot of reports. We've done a lot of work together, and I still have a practice. I still, practice. That's that's how that's my business, is still practicing medicine. But it's called actually it's called the Integrated Medicine Center of Santa Barbara, but I kind of want to change the name because I bought that from somebody else. I bought a practice from somebody that had that name. And really what I want to do is functional medicine. So what I do is, instead of looking for, instead of using a drug to treat a symptom, I look for the root cause of why things happen. So, I had a guy with Alzheimer's disease. He's years he's had Alzheimer's. His wife is leading him around, and he's like shuffling around, and then he got arthritis, and his wife was told he had gout. He went to another doctor. The doctor said, I don't think he has gout. You should go see Dr. Saunders. And so he came in to see me to see if he had gout or not. And so it turns out he was a welder and had lead toxicity, and was you probably heard this story before. I talked about it, right?
It's been a long time though.
Yeah. But it's so dramatic that in 30 treatments of EDTA chelation, he no longer had Alzheimer's and no longer had arthritis. So his arthritis went away, but so did his Alzheimer's completely. Even, today, 7 years later, he's a perfectly normal, healthy guy. So if you find the cause of something, it's so gratifying to me. And so I do a lot of work. I'll spend hours researching somebody's illness and going, what is causing this? And I've found some really interesting things. I had a kid I told you about before, with histamine intolerance. I didn't even know what that was. It took a lot of research for me to figure that out. And now he's a normal kid, whereas he was non-functional before. So,
and that might even have been, I remember traveling. We travel as a team a few times a year, a couple times a year. And I remember, I think you were up at like 4 a.m. and you had been working on something, and you came out, we were all eating breakfast. You're like, I think I figured out what's wrong with one of my patients. You were so excited. It might have even been that one. I don't remember.
No, it wasn't.
It wasn't. Okay.
It was a different one. Yeah.
And I just so appreciated that, because first of all, I don't know when you sleep, because you're always
just so that you know, I get up at 4, but I go to sleep at 10. Everybody else is up playing shame ball, and I'm in bed, at 10 o'clock. So
okay, you're right. I do know that you get up early. I did know that. But yeah, I just remember that. And so he is really doing a lot of work. He really loves what he does. So I've seen him in action. Anyway, okay. So let's get started. Today we are going to be talking about muscle wasting. And now I've heard it referenced like this. I don't know what the difference is between muscle wasting and muscle loss, if there's a connection to type 2. But we've had a lot of questions about it. And I believe you even wrote an article for Home Cares That Work about this. Is that right? No?
I don't think so.
No? Okay. So maybe it's just been popping up in conversation. I can't remember, but let's dig in. I'm going to let you go ahead and share and teach, and guys, feel free to ask questions as he's teaching about this, because I'm really excited to learn some more. So here we go.
Okay. So there's a normal amount of muscle loss that people have, and you're not losing numbers of cells so much, but the amount of muscle, the bulk of your muscle, the protein, the number of actin and myosin fibers. So the fiber numbers are decreasing, but the cells are pretty much the same all the time. And that's the normal amount of muscle loss that people get as they're older, not because they're getting older. You don't blame age for anything. That's not an issue. It's because we don't exercise, and people decrease their amount of activity. Their activity levels decline over time. So their muscles also decrease over time. And the bones do too, by the way, for osteoporosis sufferers. So it's not just a simple muscle loss like you're losing cells. It's just because you don't use it, you lose it. And that's a perfectly normal thing. So, whereas I often talk to people about their activity levels, and they say, well, when I was younger, I was a triathlete, I used to run long distance. I'd be swimming and riding my bike. And now I just don't do as much. And not doing as much is the reason that happens. And that's a normal process. Just, you don't use it, you lose it. Then there's the muscle wasting, and that's a different issue entirely. That's where you have one of two things that are going wrong, either an energy problem or you have a nerve problem. So when the nervous system is not plugged into the muscle, there's no stimulation of the muscle, and it wastes. You just lose it entirely, and you get weakness. And so people often talk about, they come in and they say, I feel weak. And I go, well, explain what weakness means. Sometimes it means tiredness. Sometimes it means fatigue. And sometimes it means actual weakness. So what's the difference? Well, tiredness is, well, I could do it, but I just don't feel like it. And I can't, I can't motivate myself to do it because I'm so tired. And sometimes that's sleepiness, but sometimes it's just a general tired. Fatigue is different. Fatigue is when I can go, but I have a stop. I used to be able to go all day, and now in 1 hour, I'm done. I am in bed in an hour because my muscles get so fatigued so easily. That's fatigue. And then there's weakness. And weakness is, I used to be able to lift 50 pounds, no problem. I used to be able to pick up that 5-gallon bottle of water and put it on top of the water bottle container. I can't even lift the thing up anymore. That's weakness. Weakness is when you've actually lost strength in the muscle. So those three things, any one of them or all three of them can indicate that you're losing muscle mass. So if you have type 2 and you're wondering, well, why am I getting this weakness, fatigue, tiredness? You could have depression. You could have a loss of brain cells where you're not getting enough brain function. And that is from, it's like Alzheimer's. We call it type 3 diabetes. Type 3 diabetes is essentially your brain not getting enough sugar because the sugar can't cross the blood-brain barrier. We've had long discussions on that. So that you get tiredness and fatiguing easily, and you're wiped out, and you can't think clearly, and you have a brain fog. Those kinds of things all fit together. That's a brain issue. And yes, because you're not exercising your muscles, you're going to get weakness of your muscles. But it's not primarily a muscle problem. It's primarily a central nervous system problem. Well, then you have the peripheral nervous system problem. And the peripheral nerves are not these brain nerves in here. It's the ones in your legs and your arms and your fingers and all those nerves. And the longest ones are the ones that are most sensitive to the loss of energy. So because you have diabetes, you have poor circulation. You don't get good blood flow. So what's the problem with that? Well, you're not getting oxygen to your tissues. And without oxygen, the nerves are going to be the first things to notice, and they're going to stop functioning. So why do people get a neuropathy, numbness of their feet and tingling and all of that? If you have that, that means that you have poor circulation, and you're not getting good energy into your muscle cell, into your nerve cells. So guess what those nerves also do? You have the numbness and tingling, but those nerves also innervate the muscles and tell the muscles what to do. And guess what? If they don't work, they're not telling the muscles what to do. And the muscles actually shrink down and go away. So you can have atrophy of the muscle just from the nerve not connecting to it because you have type 2. So, and you may not even have diabetes yet. You can have just insulin resistance and not technically have diabetes. In other words, your hemoglobin A1C is not over 6.5, which is kind of the cutoff. But yet, you can already have muscle wasting, neuropathy, dementia types of symptoms, heart problems, kidney problems. I had somebody show up, I said, you have kidney problems from diabetes. She goes, I don't even have diabetes. I've never had diabetes. Her hemoglobin A1C was technically pre-diabetes, but she had really high insulin. She was insulin resistant. And so if those nerves aren't working and they're not innervating the muscles just waste away because they're not being used. So that's another part of muscle wasting. Now, the third thing, the other part of type 2 especially is not getting enough energy into the muscles. And why would that happen? Well, insulin resistance doesn't allow you to get energy in the muscles. And if you also have low, like L-carnitine gets the fat into the muscles so you can burn fat. And what if you have both? You're blocking your sugar because you have insulin resistance and you don't have enough L-carnitine to get fat into the muscles. Then you're going to get muscle wasting just because you can't make energy in the muscles. There's not enough energy in there. And then there's the problem of the circulation not getting oxygen. So when there's like clotting problems and the blood's not getting through the capillaries very well, and you're not getting oxygen into the tissues, then they just waste away because they don't have enough energy. So there's a lot of different reasons, the ones we discussed, why you may not have enough energy to your muscles, causing muscle wasting. Or the nerves may not be working, causing muscle wasting. So this isn't just the normal muscle loss from lack of use, because you can keep that up. This is where you're seeing actual problems like fatigue, which we defined, and weakness, which we defined, and tiredness, which we define. And there are different kinds of problems. So I hope if you have any questions about that, you can bring them up in the Q&A, and we can answer specific questions you may have.
This is very interesting. Let's quick define a couple things because we usually get asked these. What is a normal A1C level?
Oh, a normal A1C. Well, okay, there's optimum and normal. So you have to look at A1C as a continuum, right? You're on a scale. So there's no line that says it has to be this. So we kind of draw arbitrary lines. Okay, pre-diabetes is 5.7. And diabetes is 6.5. An optimal perfect level would be right around 5.0. So I've had people at 4.8, 4.9, 5.2, and those ranges. So right around 5 is the optimum range. And when it starts getting into 5.6, you're in a little high. 5.7 is actually pre-diabetes, and then 6.5 is diabetes. So that kind of gives you an idea. And think of it on a scale, not an absolute number.
And then how about blood sugar numbers?
Blood sugar numbers. Okay, so if you're in the United States and you're using the milligrams per deciliter, then the normal level is 70 to 90. That's the range that a fasting blood sugar should be. And most people that I test are right around 100. They're 90 to 100, 110, even if they're considered normal and their hemoglobin A1C is a little on the 5.5, 5.6 side. A high blood sugar would be, over 150, over 160, and usually in the 200s, you would see a high blood sugar. If you're in Canada, it's a little different. Your normal range would be from 4 to 5. That would be the optimum range. And you say, wait a minute, I'm hardly ever 4 point something, but actually 4 point something is the ideal. And that's when you're over 5, over 6, over 5 is still like in the pre-range, but over 6 is in the you definitely have high blood sugar or diabetes range. And I've seen people at 9, 7, 9, 10. That's like equivalent to 200s in the 200s for the United States numbers. So that kind of gives you an idea of where that is.
Okay, good stuff. I'm going to go ahead and go into some of these questions, you guys. If you have something about type 2 that you want to ask, or really about what Dr. Saunders shared today, feel free to post that in the Q&A. All right. Lloyd is wondering, can I gain weight without affecting my A1C? How do I do it?
As a matter of fact, you definitely can gain weight without affecting your A1C. So there are several things that you can do to keep your blood sugar low and still gain weight. And one of the easiest things is to not do our program. Our program is a ketogenic diet, and it's a cleanse from sugar. But if you want to gain, if you want to gain weight, what you want is muscle. You don't want to gain weight by having a lot of fat on your body. Well, we don't, because fat's so easy to get. But so the easy way to do that is to have a carbohydrate diet and no fat. Just avoid fat. Like don't even eat an avocado. There's a website called Mastering Diabetes. And it's written by two young men who are both type 1 diabetic, and they're also very thin, by the way. But you can eat quite a lot of carbs and work out and get the protein you need without adding fat, and that allows you to make more insulin so that you can get anabolic and put on more muscle too. Yeah. Okay. You could do it the other way with the ketogenic diet. People that do paleo ketogenic, they avoid carbohydrates and eat protein and fat. But the hemoglobin A1C usually goes up because the fat makes you insulin resistant. But if you're not eating carbs, that would work too. So you can actually do it either way.
Interesting. Okay, keep us posted, Lloyd, on how that goes and what you decide to do. It's always interesting to see what works for different individuals. So, okay, Sharon says, I've been told that I have poor kidney function, diagnosed as pre-diabetic. Can I expect my kidney function to improve using the program?
Okay, good questions. I've looked at this many times, and what I found is that kidney damage that's been done from diabetes, because the glomeruli aren't there anymore, that it doesn't return to normal function. In other words, you're not going to get function back. Definitely get on the program, because that will stop it from progressing. So you want to have a lot of, you want to have normal blood sugar. You want to have normal hemoglobin A1C. You don't want insulin resistance. So the primary problem is insulin resistance. And so, and the other thing with the kidneys is you want to repair the lining of your intestines really well. So I often recommend people that have that issue to drink bone broth, because the bone broth you boil the bones for a long time and you're getting collagen in there. And that's why it gels up when you put it in the refrigerator. The gel is all the collagen proteins. So that gives you the glycoproteins, the things that you need to regenerate or rebuild the blood vessels. So those are the things that I would do for kidney. Yes, you definitely want to get on the program to avoid further damage to your kidneys.
Okay, question here from Don. Let's see. This is not a blood sugar question, but you mentioned chelation therapy. So I'm curious if you're familiar with an oral product called Angioprim. The nearest chelation doctor to me is a 5-hour round trip drive. So I just started on this oral product because of that. It involves slowly sipping the solution for a minimum of 24 days. In my case, I may need a packages to deal with my plaque blockage and high LDL readings. Thanks, Don in Tennessee.
Okay, Angioprim Plus, the advanced chelation formula.
Can you talk about what chelation is again?
Oh, okay. Chelation is an amino acid that binds to heavy metals, and because the heavy metal is stuck to the amino acid, it gets the metal out of your body. So the word chelation literally means eating, and so it's kind of like this amino acid. It binds to it. It like eats the lead or mercury or whatever, because the body doesn't use that amino acid, then it just gets excreted in the urine. It doesn't get reabsorbed. So chelation is very effective. I've used it for all kinds of things, heavy metals primarily. So I'm looking up this Angioprim, and
I know there is like the sprays that do that too, like TRS, I think it's called a TRS spray, something similar.
Yeah, there are several different kinds. And I don't know all the brand names, but I know all the chelation agents. And the EDTA is the most common one, ethylene diamine tetracetic acid.
Did you just ramble that off the tip of your tongue just like that?
Yeah, well, this is my business. This is what I do.
I know. It's just amazing.
So, okay, activator and chelation.
While you're looking up that, I'm just going to mention, I can see Butch is on and he has a question. I had such a great conversation with Butch. I'm excited. I haven't shared that with Dr. Saunders yet. I think I actually just got the video back. So fun. Guys, if you are interested in sharing a little bit about your journey with me, I would be grateful. I actually just met with him maybe last week or the week before, but email me Leslie@bartonpublishing.com. And I would love to just, we just hopped on a video chat and he just shared a little bit of his story, and just awesome and so fun to meet you guys. So, and I think I may be hearing from his wife as well. So anyway, okay.
Okay. So Angioprim is EDTA and serapeptase. It also contains omega-3 and vitamin D. Okay. So, and that as a chelator, it is, if it's an oral, they call it sublingual. You can put it under the tongue. But the problem with EDTA, it's an amino acid that is changed by the body, and it's not absorbed very well. And so it's not good. It's not very useful to take an oral dose of it. Yes, you do get a small amount in the body, but if you really want to get stuff out of your body like lead or mercury, well, not mercury, lead, then EDTA is the best agent for that, but you really have to give it IV if you want to get that out. And so, but there is an oral. So for that person that asked about chelation, there is an oral chelating agent that works very well, and it's very well tolerated. It's again an amino acid that the body doesn't use. So, but it is absorbed. It gets into the body, and it binds to most of the heavy metals that cause damage, like mercury, lead, arsenic, tin, and I've used it for all those purposes. It's called DMPS, or DMSA. DMPS, yeah, it's not as good. DMSA is it's a succinic acid, which is an amino acid. So dimethyl succinic acid. So that's a better choice than this EDTA one.
Okay.
And by the way, for those of you who want to know about chelation, there's another little trick that you might want to know about, and that is glutathione is a great chelator. And if you take N-acetylcysteine, then you make more glutathione, and that's the best way to get mercury out of your body. Well, as long as you add cilantro and chlorella. So cilantro, chlorella, and then the N-acetylcysteine, NAC, which makes more glutathione, which gets mercury out really nicely.
Wow. Okay. That's a lot. That's a lot of information.
I overload. I just love the information, so I overload people.
No, I love it. And the best part of this, guys, I'll just throw this out there right now. These are recorded. So you can go back and rewatch this and hit pause. And that's what I always do whenever I'm watching. I'm like, oh my goodness, so much. And it's such good information. But bartonwebinar.com, there is a link to our YouTube channel where you'll be able to find all of these. And the guy that edits our videos, he was busy for a couple of weeks. So we have a whole bunch of them that I actually just got back, and I'll be posting a bunch of the newest episodes. So our friend Sharon's here. I got to chat with her as well. It feels like all my friends are on because I got to like see them and I know their stories, and it's so fun. But she says, thanks for everything you and your team does. With each webinar, I gain so much information. Thank you for sharing that.
Good.
Okay. This is a good question from Bob. Does age make a difference in the optimal levels for like blood sugar, hemoglobin A1C?
No. You know, it does change over time, but not because it needs to change over time, but because of all of the other issues like inactivity and building up the insulin resistance. And so, yes, you'll see it change over time, but your ideal levels stay ideal throughout your life. Great question.
Yeah. Another friend, Timothy's here. Hello, Savage here, he says. Nice. Savage lost another 3.4 pounds in the last 2 weeks. Thanks for your guys and gals and Dr. Saunders. That's awesome.
Yeah.
Thank you for sharing that. You know what? I'm going to get your guys' permission. I think I need to share all of your stories. They're just so awesome. I've just loved hearing them. Okay, I got to move on here. Lots of happy Thanksgivings. Chris is on. Hello. Chris is on. Hello. Happy Thanksgiving. Dan, we have Lars from Oslo here. Bob is here. Okay, here we go. Ernest and Jean Unger. We have been on the Diabetes Solution Kit since the last week of September 2022 with all the vitamins from Barton Nutrition. I went from 6.7 A1C to 5.0 this past week.
Wow, that's ideal. That's beautiful.
And here's the fun part.
See that. Awesome.
Ernest says I can get off of metformin. Jean dropped hers from 7.8 to 6.3 and soon will be off metformin.
So she was diabetic. She's no longer diabetic. Now she has pre-diabetes. That's amazing. That's great. Good work.
Okay. I'm going to copy this because I love to share these with our team. So then I share it in our little team chat and then everybody gets excited and sends all these little emojis and stuff. And it's so cute. So I'm going to share that. Okay. Butch. Okay. And Butch had a question here too. Let's see. I thought I had heard at one point that some people are taking Synachroma with each meal. Is that okay, bad, or a good thing?
No, I don't remember we talked about each meal. We did talk about when people first start out, they could take it twice a day. But the formulation is made for once a day, and once a day is a supplement. So that's what I do as a supplement. And because it has the nutrients that are common deficiencies that can affect blood sugar, like chromium, but it's like a full dose, and the vitamin D is a full dose. It's 5,000 units in one pill. So if you're taking 2 a day, that's 10,000 units of vitamin D a day. And if you take 3 a day, that's 15,000 units a day. And I've had people get too much from taking 15,000 a day. So, and too much is not a big deal. It's not actually a vitamin, it's a hormone, and it doesn't get toxic. What it does is it causes your intestines to absorb more calcium. So your calcium level goes up and you can get cramps and stuff like that and get nausea. And that's the toxicity of the vitamin, but it's not really toxic. It's just that you've absorbed too much calcium.
What's considered a toxic amount?
Well, over the blood level over 100. So, but yeah, something more than 10,000 units a day would be
okay.
Could be toxic.
Okay. How do you do your vitamin D? Do you still dose it once a week?
Yeah, well, mostly, but with the Synachroma, I don't have to. I miss doses and stuff like that. And then the other thing about Synachroma is we've added in vitamin K, and the big advantage of the vitamin K is then you can get the calcium into your bones instead of causing like toxicity, causing your blood levels to go up. So, yeah, it's good.
I am starting to see that people are selling vitamin D with K now. I'm like, did they not know that 5 years ago, they must not have.
Yeah. No, well, it wasn't common knowledge, and now they're going, hey, you know what? That's actually better for osteoporosis. And you know, the drug companies that make all the osteoporosis medications are saying, well, that's not any good. You know, you might as well just take our drugs. And the drugs are horrible. So no, don't do
that. Okay. Susie, hello. She's from California. I have a question here from Bob. Let's see. Okay. Started the diabetes solution kit on October 25th of this year, completed 30 days on the program yesterday. My 30-day average was 111, was motivated to start the program after A1C was 8.2. I got a call from my doctor and he advised that we needed to start insulin. Told him I wanted to try diet first. I take Janumit 50 at 100 milligrams twice daily, and glymeride 2 milligrams twice daily.
Yeah.
Am I far enough along to reduce any of the meds? Is it glimepiride? What is it again? I can't remember.
Glimepiride is
glimepiride. Okay.
Glimepiride. And then the Genumet is two different medications. It's Januvia and metformin. So then they put those. So it's actually on three medications, three different medications.
Okay.
So the hemoglobin A1C went down to, what was the?
He doesn't say. I think it started at 8.2, and that's why he got the doctor said, we want to give you insulin.
And he said the average was 111, but I didn't hear what the A1C was. So the average being 111. Yeah, the first thing I would get off, I talk to your doctor, of course, because I don't know your whole program, your problems and other issues. But the glimepiride is something that kind of tricks the pancreas into making more insulin, and it causes you to be more insulin resistant. And so I would start first, stay on the Januvia, get rid of the glimepiride. So talk to your doctor first about, I'm worried about the blood sugar going low. Can I stop the glimepiride, which can cause hypoglycemia? So if you tell your doctor that, then they'll almost always go, yeah, of course. That's because the doctor wouldn't know about that. So it's something that you have to tell them.
Sure. Okay. Alan says, I've never done a bone broth fast. How do I do it? Is 2 weeks too long?
Oh, that's great. I had a guy who did, he was a little overweight. He had diabetes. He had diabetes, hypertension, and sleep apnea. And he wanted to get a commercial driver's license to drive people around. And they wouldn't give it to him, of course, unless you'd been on medications and stable and all that stuff. And he goes, I don't want to do medications. I said, well, then your only option is to reverse it. So I said, when do you need to get your license? He said, yesterday. He said, this has to be done already. So I said, okay, the fastest way to do this is a bone broth cleanse. So he drank broth, and I know about the daily because he blogged the whole thing. And so he had 3 crock pots going, one with chicken bones, one with beef bones, and one he put a ham bone. He called me first, can I do a ham bone? Yeah, fine. So he did a ham bone in there. And and so he's got the crock pots hot all the time, all 3 of them on his counter, right? And he just takes little out, dumps some more water back in, and spices it up again, and then heads off to lunch with his thermos full of bone broth. And so he lost 30 pounds. He didn't have diabetes. He tested hemoglobin A1C was non-diabetic. His blood sugar was normal. He didn't have sleep apnea anymore, and he didn't have what was the other one? High blood pressure. His blood pressure came down to normal, and he's drinking this broth that's got a lot of salt in it. And they go, oh, that's bad for your blood pressure. No, because when you get the insulin resistance down, then the blood pressure automatically comes down. So because your kidneys start functioning better. So how do you do it? Well, the way you do it is generally it works out to have about 16 ounces twice a day. So you have a good quality broth, and making it yourself is just fine. But now you can get it anywhere. And bones have become so expensive in California. It's amazing what it costs to get bones. They used to give them out free. I want some bones for my dog, and they'd wrap up a whole big batch of bones, and you pay $1 for it or whatever. And now there's like $10 a pound.
Yeah,
we're paying $10 a pound for bones. Anyway, getting off the track. So you can buy the broth. And the really good broth is gelled when it's cold, but most other broths is okay. You do 16 ounces twice a day, and you don't need to add any other food or any other liquids or anything. If you're taking vitamins, you can take them with your broth if you need to, because the broth already has protein. That's what gels, right? It's the protein. It's got fat in it, got a little bit of carbs in it, but it's got vitamins because the bone marrow has like all the B vitamins, because that's where all your your cells are being made for your blood. So it's got everything you need in it. 16 ounces twice a day, and it's best to do it morning and afternoon and skip the evening. So that's the way to do it.
Okay, awesome. And bone broth is good. It's really good.
Well, I have to spice it up. I don't like it unless I
Add
put.
stuff.
Yeah, I add stuff. So, so one day I'll make, a broth and it'll be like an Italian flavor. So I'll use a bunch of, oregano and Italian kinds of spices. And another one I'll make that'll have turmeric in it, and it'll be more of a curry kind of broth. And I found that really helps because I'm a flavor guy. I just, I cook and I need the flavors.
Yes, I get it. And salt helps a lot too.
Yeah. Oh, yeah, definitely. I got a salt in it.
Okay, William, welcome back. My brother is lowering his blood sugar levels to 140 from 380 following phase 1. Wait a minute, your brother is doing this now. This is awesome. I don't know if I know we have talked about your brother, but I didn't know if he had started. He's lost 38 pounds, but wanted to know how to get his testosterone to take over so he can get rid of man boobs and belly fat. His testosterone level is at 520 last month. I recommended taking a DIM supplement to save having to eat bushels of cruciferous vegetables. Is there more I can recommend?
No, that's great. I usually recommend the cruciferous vegetables instead of the DIM, because besides DIM, the cruciferous vegetables also has sulforaphanes and I3C, indole-3 carbinol. And those are also helpful. So I don't know, have the cruciferous vegetables instead of the supplement. Remember, that's what Leslie was saying. It's really all about food more than about pills. And then 500, between 400 and 600 is the optimum level of testosterone. So his level of testosterone is just fine, not a problem there. So what happens is, though, when you have a lot of belly fat, then that testosterone is made into estrogen, and that's where you get the man boobs and the estrogen, like the feminine characteristics. Mm-hmm. So the key to this is he's already doing it. If he's lost 35 pounds, that's amazing. That's a great place to start. And as the insulin goes down and the belly fat goes down, then that he'll keep his testosterone and won't make it into estrogen anymore. And then all of that fat, the belly fat and the man boobs, will go away.
Awesome. All right.
Wow. Good work, man. That's amazing.
It is.
I love to hear that.
Butch is asking, are there any spices that should be avoided?
Spices, sugar, stevia, anything sweet. Yeah. Everything else is good. Everything else is on the plate.
Sue's asking, is the Costco bone broth actually good? I don't know if I've had it. I've purchased a lot of bone broth, though.
Yeah, but my wife bought one of those boxes of Costco bone broth, and we used it, and it was fine. It was good.
Okay. Good deal. Let's see. Okay, I think we answered all the other questions. Sue, if I missed anything, let me know. Okay, let's see. Dr. Jonathan Lockwood. Just got the latest update on my blood test. My A1C is at 7, down slightly from my previous 7.1 in August, but still heading in the right direction. My C-peptide is at 2.13 as of last Friday, well within the standard range. I have stopped taking the 11 units of insulin as of last night, but I'm undecided about the 500 milligrams of metformin. Please advise. My cortisol numbers are normal, as well as my thyroid function numbers. I'm also continuing to take Synachroma twice daily, and their Novala is also having a salutary effect on relieving my foot neuropathy. Also continuing the diet modifications that have obviously helped me so far. Any additional recommendations or observations on the low levels of insulin and metformin I have been taking?
Okay, good. Okay, so 11 units of insulin is not a whole lot. And it's good to get off of that because the more insulin you take, the more insulin resistant you get, and you're trying to reverse that process. So the hemoglobin A1C dropping from 7.1 to 7.0, that's great. The amount of metformin you're taking, 500 milligrams a day, is not an effective dose anyway. It's not something that's going to change your blood sugar. So whether you stay on it or not, it might have some effect as far as helping you to burn fat instead of carbohydrates. But you're better off on the program anyway, in the long run. So you could continue the metformin, or you could get off it. It's not the amount you're taking is not enough to affect your blood sugar. And stopping the insulin, good idea. You don't want to get hypoglycemic. Insulin can do that, especially as you're becoming more insulin sensitive. You're more likely to get hypoglycemic. So I think you're already on the track, and just continuing on that and having your hemoglobin A1C come down and to 5.0, like that other woman was saying earlier. Like, gosh, crazy.
Okay. Okay. I have some questions in here I think I might have missed. All right, let me see. This is from Eric. So I believe he had prostate removal due to prostate cancer. It needed 7. What I was, and I had prostate removal and PSA, 0 to none, finish up, maybe 1. Okay, hold on a second. I'm not sure what this means. I think he's asking, an option is to have low power radiation therapy, or I go back to the lab for a PSA reading. They're going to keep an eye on that. And then he's talking about my low power radiation therapy in that area. What do you think? Does that make sense to you?
Okay. Yes, it all makes sense to me. Because what he's saying is his PSA was 7, and so he was had a biopsy, found out he had prostate cancer, so they did a prostatectomy called a radical prostatectomy. They removed the whole thing, and so his PSA went down to 0 essentially, and less than 1, which it should, because you don't have a prostate anymore. You shouldn't have prostate-specific antigen. So then they follow the PSA over time, and if the PSA starts going up, then that there's somewhere in the body, whether it's in where the prostate is or somewhere else, there's prostate tissue growing, and so following the PSA is a reasonable thing to do. Personally, if you've had the prostatectomy, radiation is effective for shrinking things, but since you don't have anything to shrink, I don't know that I would do that. I think what I would do is follow the PSAs to see if there's anything there. But there's a whole lot of other factors that enter into this, like your age, and whether you have metastases or what other illnesses you have, and diabetes will affect it, because it affects your and we were just talking about testosterone and estrogen levels. The more estrogen you have, which is an anabolic hormone, the more prostate cancer you're going to get. And they get rid of your testosterone because that's made into estrogen. So, but it's not the testosterone, it's actually the estrogen. And that's been shown in multiple studies.
Okay. All right, good stuff here, guys. Let's see. Robert says, I've been on a low carb diet for 6 months and my regular blood sugar was down in the 90 to 110 range, but now has gone up and runs between 150 and 200, even on the low carb diet. Why and what do you need to get it down? After being on the program for 6 months, my A1C went from 7.4 to 5.8, yet my blood sugar is running high. Why?
Okay, so the hemoglobin A1C is an average over approximately 3 months, 2-3 months. So it's sort of an average. Whereas your fasting blood sugar is showing roughly still similar results. And that's really important because what you're looking at is how much improvement you got from going your hemoglobin A1C from the 7s into the 6s, or 5.8. You're technically non-diabetic now. You're pre-diabetic. Why is that? Well, it's because your postprandial or your after eating blood sugar is not going up into the 200s and 300s anymore. It's staying up in the 100s because you don't have as much insulin resistance. So really, there's a whole lot of progress there. And I know it sounds frustrating to, check your blood sugar. Dang, it's still 100, and you want it to be 70 to 90. It can take a while because you have this initial really great benefit, and then your benefits, for the effort that you're putting in, you're still putting in the same effort, and your benefit isn't as much because it kind of levels off somewhat. But it'll be more gradual from here on out. But that's fine. That's fine. Just keep going. You're doing a great job.
Yeah, awesome. Allison says, I have a friend who has MS, and you mentioned that Alzheimer's was caused by a lead overdose, I think. Do you know if MS might be caused by the same thing?
Okay. Not lead, but there are plenty of other things, toxins that cause multiple sclerosis. So there is a doctor, what is her name? Terry Walls. And she was a family practice doctor, but she was like karate champion. She was very physically fit, and she got MS, and so she wrote a book on how she reversed her MS. And there's a TED Talk video on minding your mitochondria. But she wrote a book called The Walls Protocol, WAHLS, and so look into that and look into MS recovery, because yes, MS is fully recoverable and fully fixable. She proved it.
Awesome. Eric is wondering if you take insurance or do people pay out of pocket?
I take insurance, but I also have a membership, so people pay $100 a month, and then that's and I work through their problems with them.
Okay.
And then I bill the insurance for office visits.
Yeah. Okay. A couple questions here. Deborah's wondering if we have done a webinar on fasting. Yes, we have. Actually, quite a few. If you go to bartonwebinar.com, again, there's a link to our YouTube channel. Type in fasting or fast, and it'll pull up the webinars that we have done on that. Eric says, my doctor doesn't want to give me the C-peptide study because he doesn't know how to, and or they've come up with some other excuse. How would I go about getting it done?
There are, depending on what state you're in, there's a lot of states you can walk into a lab and say, I'd like this test done. If not, there's online, anylab.com. You can just order the test, and they send you a kit with the tube in it. You have to get a phlebotomist to suck your blood out and put it in the tube, and then send your kit off to the lab, and they'll give it to you. Yeah, or find another doctor to order it. People come to me sometimes and says, "Okay, my doctor won't order this test. Will you order it?"
Yeah. Chris says it seems that Parkinson's disease is on the rise these days. Are type 2 diabetics prone to get Parkinson's as they age?
That's really interesting. That's a great question. And no, Parkinson's is not significantly higher in among type 2 diabetics. as opposed to like Alzheimer's or dementia, which definitely is, because Parkinson's is caused by a different type of toxicity. Parkinson's is a toxicity of the dopamine system. And so when you destroy dopamine, you get Parkinson's. And that's what like organophosphate pesticides in food has been definitely linked with Parkinson's. And so, and other things, glyphosate. So as we're seeing more Roundup and more, I mean, we're talking about, they measure the amounts that they produce of these really, really, really toxic substances that are toxic to the brain, destroy the dopamine system and cause Parkinson's in terms of millions of pounds or tons a year of that are produced and dumped in our world. So, it's not like you can avoid it really easily. So, so the best way to handle that. Okay. So I'm just going to give a little tip here. There's toxic stuff all over in your environment. Okay. Avoid sugar. The number one cause of death from toxicity is sugar. By sugar, I mean any kind of sugar, sucrose, honey, corn sweetener, agave nectar, high fructose corn syrup. All of those put together are sugar, and more people die from sugar toxicity than all other toxins combined. Okay, so now having said that, how do you protect yourself from the other toxicities? Because our diabetes solution kit that Leslie showed you a few minutes ago is the solution for that toxicity. That's the detox program for that toxicity. So all the other ones, like for Parkinson's and all that, the best way to detox is periodic fasting. If you do periodic fasting, it allows your body to clean out toxins. And then eat good food and make sure you get a lot of fiber in your diet. And those are the general principles for keeping your body free of toxins and avoiding the side effects and the problems from our toxic world.
Dr. Saunders, normally you need to leave. Do you have a couple more minutes?
Yeah, I got a couple minutes. If you got more questions.
Here we go. Let's see what we have here.
It's vacation, huh?
I know. My daughter's waiting. She's going to help me cook some stuff this afternoon, but okay. I want to get through some more of these. Olivia said I had a lab test today, crossing fingers for results. In meeting with my family doctor. So far, my daily blood sugar numbers have been in the low 6s, and today was 5.4. My doctor runs a diabetic clinic, and I see him every 3 months. He's been proud of my achievements. He says I should advise his patients as they don't listen to him. He says I'm his best patient. Thanks to you guys for these webinars. Very reinforcing.
Wow, good work.
Olivia, you're in Canada, right? I believe she's in Canada.
Your hemoglobin A1C is non-diabetic. So she's still going to a diabetes clinic and she doesn't have diabetes. 5.4. I
love the question we had last week. Someone said, so if I improve all of my numbers, I'm no longer diabetic. Will they still let me get the continuous glucose monitor? They were worried about it. And I was like, God, that'd be a great problem to have. Yeah. Hopefully you can still have it.
I would wear one of those. You can get them. You can. Well, you can get them online. You don't need a prescription. You have to pay cash for it though. Yeah. And I don't know, it's not that cheap, but I don't know, a couple $100. I don't know what it costs.
Oof. I'm going to look.
One of my patients got one.
Oh, actually, I think we better mention this to Joe. Christmas is coming. So
He's going to have CGMs for the whole team.
Everyone will be like, wow, thanks. I would love it. Actually, most of us, I think, would absolutely love it, truthfully. So, all right, I'll take a note to make sure I do that. No. All right. Let's see. Oh, Krish, let's see. Did I miss part of your question? Oh, also concerning Parkinson's, I think wondering if good nutrition and supplements would help to prevent that for people with type 2, but I think you kind of talked about that. Let's see here. All right. Some more from Eric as well. Chris, can I meet your 2 kids? I think they're outside right now. I think Dad made them go outside to shoot hoops. They were too loud. I have the diabetes solution kit. Is there a difference between the DSK? Oh, look at Dr. Saunders' family.
That's my kids.
Cute. My kids, well, they're getting older now. Do you have a picture in here? Chris, yeah, they come in, I'll grab them. Okay. Is there a difference between the DISC, the diabetes solution kit, and the diabetes boot camp? Should I do both?
The boot camp is what helps you get through. That's all the videos.
Oh, okay. Yep.
The boot camp is like a help to kind of explain things and to help you get through it. It's nothing different than what we do here on our webinars. The solution kit, I mean, if you read, the solution kit contains all the information. There's nothing different about it particularly.
Yeah. Yeah, you're getting a lot of good information here on the webinars from Dr. Saunders too. So if you apply what you're finding in the diabetes solution kit and joining the webinars, you're going to be set. Okay. Olivia said the continuous glucose monitors are free there, and other parts that go with it are not free. Yes, she's in Canada.
Yeah.
Okay, let me just quick see what I have here from Eric, and then I think we'll be good to go. Eric said, Dr. Saunders, I forgot to add this. Headaches, PET scan, and he said I come up negative, but wasn't anything there. So I know where the disease, anything like that. So I was negative on that. I thought I'd throw that out there and let you hear that. The PET scan the urologist ordered, and it was negative. Okay, no other diseases.
Good. Okay. So for the somebody that has prostate cancer, a PET scan is looking for areas of cancer anywhere in the body. So it's a CT scan, a CAT scan that they're looking for where in the body there might be some cancer metastases. So he doesn't have any. So in that case, you know, I personally wouldn't do radiation. I can't advise you on what to do, but I personally wouldn't do that.
Right. Okay, last question here from Edward. If my A1C missed the first part of the webinar, okay, I'm not sure what that says, but I have type 2 diabetes. A1C is 8.2. I take 60 units per day of Lantus and 1 unit of Ozempic. If I do the bone broth each day, will I improve my blood sugar readings?
Oh my gosh, if you do the bone broth instead of a meal or 2 or 3, yeah, of course you would. That would be awesome and excellent. But you have to be really careful, because if you're just doing bone broth, you're not getting a lot of carbs, and that amount of insulin can, and even the Ozempic can clearly drop your blood sugar through the bottom. So be very careful with that, and talk to your doctor before doing that.
And don't forget about the diabetes solution kit too. If you aren't already using this would be something to consider as well. So at bartonwebinar.com, you'll find information about this. I think that's it, guys. That's it for today. We went over, but we had to take advantage of Dr. Saunders' day off, right? Sorry. Anyway, we're just so thankful for you. And in this Thanksgiving season, we're especially thankful for you. So we'll be back next week, guys. More information on type 2. So have your questions ready, and we will see you soon. Have a great week.